Welcome to our 7th episode of the HLI podcast. Today we have gone a slightly different route and have it as a Facebook Live session, so you can access us in real time. Our topic of discussion is vaccines. We have with us Noel, Saurabh, Suk, and I, Susmita, to share varied viewpoints, concerns, and thoughts on how better to address the current and future pandemics.
So thank you so much, everybody, for joining us today on HLI's very first live podcast here on Facebook Live. Today we have with us Suk, who is a Canadian lawyer currently living in Geneva, Switzerland. She works in international advocacy through the Sexual Rights Initiative and Youth Coalition for Sexual and Reproductive Rights. We also have Saurabh, who's a recent PharmD graduate and a prospective public health master's student at London School of Hygiene and Tropical Medicine, and Susmita, who combines her healthcare and legal backgrounds to explore and inform about health worker rights, universal access to healthcare, and advocates healthcare workers as key actors in health system strengthening. She is also the founder and president of the Health Law Institute.
Thank you, Noel. A little bit about Noel. Noel is a prospective student at the George Washington University in Global Health Policy. She is a lead content creator at HLI, and during the time I've known her, I've found her to be a resolute advocate for health workers' rights and healthcare accessibility. To start off, Noel, what is the most pressing thing you have on your mind today about vaccines?
I guess now that the majority of my friends and family and myself are all fully vaccinated, I find myself thinking about what's next. And with the new COVID-19 variants popping up all over the world, booster shots are at the top of that list. Booster shots are only necessary, obviously, if the vaccine immunity fades or doesn't protect against all these variants. But I worry about the viability of a booster shot rollout for a few reasons. First, there's already a debate on whether or not it's premature to even start thinking about a booster, given all the gaps in knowledge we still have on both the virus and the vaccines that we have to fight against it, including whether or not a booster is even needed. If there was evidence of waning immunity, that would make a case for a third dose, but it's still too early to know anything for certain about that. Yet countries like the UK have already ordered another 60 million doses of Pfizer and biotech for fall and winter booster programs. But given these knowledge gaps, I wonder, would these shots be more useful in India or somewhere that needs it more right now? Secondly, I worry about our global capacity to roll out a second or third shot before we've even finished giving out the first one. I think it's fair to say that the first vaccine rollout was not as efficient as everyone had hoped it would be. And while we've learned a lot in the past year and will inevitably do better next time, will we have the means to do so? And more than that, which brings me to my final point, will we have the same drive? Because I think a lot of people are tired and it's been a long and challenging year for everyone. And I worry that if we tell people they need to keep coming back for booster shots year after year, we're going to start to see some vaccine fatigue and burnout. Convincing people to get vaccinated is much easier when you tell them it's one and done rather than telling them they have to keep coming back again and again. And obviously this isn't to say that we shouldn't be looking into a booster shot, because as we've learned over the past year, preparation is key in fighting this virus, or fighting any virus for that matter. But I think these are important questions to keep in mind as we start developing them. And speaking of what's next, so I know you had some thoughts on intellectual property.
Hi, everyone. Yeah, for me, I think the biggest issue as we continue to deal with this pandemic is the stark differences between access to vaccines. And there's been a lot of advocacy around having a people's vaccine, and many or even most of the vaccines that currently exist for COVID-19 have been funded through taxpayers' money. But the result of that funding, research, development is now considered intellectual property of these giant pharmaceutical companies. And of course, the profits are theirs as well. That currently exist for COVID-19 have been funded through taxpayers' money. I don't know if there was just a lag.
I think it was a very important point. So it just echoed back at you.
Now that I've emphasized that twice, moving on. The results, as I said, the results are part of these giant companies. And with that, there's legal restrictions on production or mass production of these vaccines for everyone. So many states, mostly the ones that are continuing to struggle with the pandemic, a lot of them experiencing new mutants of the COVID-19 virus, have advocated and requested over and over to even have a temporary suspension of the patents around the vaccines. And there's also been repeated recommendations from many international human rights mechanisms, including the WHO. However, there hasn't been a resolution so far. And it's unfortunate because the pandemic continues to spread, infect, mutate, and kill people around the world. And the result of this is this big difference between mostly what's happening in global North countries and global South countries and their access to the vaccines. And some of the countries that are mostly fully vaccinated by now or on their way to be fully vaccinated, they're able to go back to normal, whatever that means, or like at least open up fully as they used to, while other countries continue to experience the worst part of the pandemic for them, where a large population of their countries infected and experience a high percentage of mortality. And unfortunately, it's also the countries that have vaccinated most of their population who continue to obstruct the production of vaccines for the masses. And also, as Noel mentioned, some countries are already ordering booster shots, while others struggle to even vaccinate their most vulnerable populations. And I think lastly, it is worth thinking about what getting back to normal looks like, because I think even between us and some of our countries, it's already getting there, or we have an end in sight. Like this percentage of the population will be vaccinated by a certain point, and then things will open back up. And how different those timeframes look for certain other countries. And of course, to tie it into the rights of health workers in many parts of the world continue to struggle physically, mentally, dealing with the pandemic, and there's no end in sight because of this stark difference between access to vaccines.
Thank you, Suk. Those are such important points. And I know a large part of returning to normal is getting as many people as possible vaccinated. And Saurabh, I know you wanted to speak a bit on vaccine hesitancy.
Hello, everyone. So in a much more literal sense, vaccine hesitancy is delay in acceptance or refusal of vaccines altogether, even though they are available to the people. But vaccine hesitancy, it is a much more complex and a context-specific topic, and it is a much of an issue that is around us. And in the current scenario, as well as in the past, the prominent factors influencing vaccine hesitancy are lack of awareness, mainly about the science of the vaccine and the benefits and the risks of the vaccine. And then there is fear. Then there is lack of access to vaccine. Then there are civil liberty issues. And then there are some kind of confidence deficit in the system or in science. And all of this is sown by or is led due to disinformation, or there is a conspiracy theory behind, as we have seen prominently that Bill Gates was behind vaccinating everyone. So he emerged this pandemic all by himself. So such kind of conspiracy theories. And to dispel this vaccine hesitancy altogether, we need to understand who are the actors in it. So I'd like to categorize vaccine hesitant people into three categories. Now, they are anti-vaxxers who completely dispel the principle of vaccine and they don't agree with the science behind vaccines and they don't want to get vaccinated at all. And then comes the people who just want to delay their vaccination. They believe in vaccines, they believe in the principles, but they just want to delay those vaccination shots. And then there are free riders. Just like the name suggests, free riders are those who don't want to get vaccinated, but just want to derive the benefits from it. So all of these people are categorized and it should be categorized and should be tackled differently when tackling vaccine hesitancy. So now how do we tackle vaccine hesitancy? There are certain points on how should we tackle vaccine hesitancy. First of every department or every government or every organization looks to dispel the fears. And how do we do that? We do that by focusing on simple facts like vaccines are safe, vaccines are well tested, vaccines have a very less common and very less side effects compared to the effects that the disease has. So all these kind of what do we say, facts are in place. But the most important thing to tackle vaccine hesitancy is the disinformation. Now, how do we tackle that? And simply quashing rumors and conspiracies with truth may not suffice. Before attempting to persuade people, we need to understand the basis of their fear, the hesitancy there, what are the basis of the hesitancy, and why there is this anti-vaccine attitude amongst themselves. So by that, we should challenge each one of them. We should target each one of them separately. And we should understand that directly challenging untruths and directly dispelling whatever they know can result into feeding the perception that we are not true. We will be directly challenging themselves, and that can become a hostile kind of situation, and they would believe more that we are hiding the truth. And so that should not be done. Therefore, I believe that more than science in today's world, we need guidance. We need guidance for the people to make them understand the science. And that can help us move forward with achieving some great results in vaccine hesitancy, because practical information is more important. And the most important point I would like to highlight here is that consequences of vaccine hesitancy are very grave. And we need to understand this now. And it is a high time that we understand now. So the consequences that I would like to highlight here is disease outbreak and pandemics will prevail. We need to get over our vaccine hesitancy problem if we want them to end it for once and for all. And there are greater chances of mutation and emergence of new variants. And there will be greater burden on healthcare system, and eventually it will collapse every now and then whenever the pandemic comes, as it happened in India, as well as in Spain, as well as in Italy in the current COVID-19 pandemic. I'd like to highlight a recent study here that was done just before the pandemic came. And it showed that a 5% reduction in measles, mumps, and rubella vaccination resulted in threefold increase in measles infection in USA. And it cost around $2.1 million to the government. So we need to understand that these resources could have been utilized. These $2.1 million could have been utilized by the healthcare system where it had needed. And that could have been proven as an asset in the pandemic if we would have not spent it on the measles outbreak that is a preventable disease. So it's clear that now we should understand it and we should take the action now. Otherwise, the sword of reemergence of previous pandemics is hanging on all of our heads. And so I'd like to quote Dr. Tedros here that no one is safe until everyone is safe. So we should all encourage everyone, and we should all encourage around us. Like if it's not the duty of healthcare professional or the government employees to dispel vaccine hesitancy. It is for us common people as well to educate people in our surroundings that vaccines are safe and you should take them.
Yeah, thank you, Saurabh, for your thoughts. I would really love to return to that later in the conversation. But first, Susmita, would you like to share the health workers' perspective?
I would love to. I think, we had such important topics, especially like, touching upon tackling IP issues and what we said, the pandemic has no borders. It's essential that, each of us are protected, that we need this united international response. And that's where, SHARP focuses on the vaccine hesitancy or even what's to come, booster doses, or how do we get everybody vaccinated. But I think in all of this, the assumption that we're making that as soon as the vaccines are there, they're going to be administered, right? But what is really the key to administering this is the health workers. What I keep focusing on is that even after we've solved all these issues, we've solved what we call the last mile delivery of supply chain issues, we have the last minute delivery problem, and that is from the health worker to the patient. It needs to be administered. We haven't yet been able to leverage technology, I guess, for that last step yet, and I'm not very sure that will happen. I'll kind of take it back to the US and the workforce that we have vaccinating here. Pharmacists have been trained to vaccinate, which has been really great because we have expanded workforce that's able to vaccinate the population. And during COVID, we saw the federal retail pharmacy program that was, introduced kind of to leverage the strength and expertise of pharmacy partners. Till date, I believe there are like 21 retail pharmacy partners. So that's like 41,000 locations that are able to administer. And as of June 3rd, 80 million vaccines have been administered, including 8 million through the long-term care. As we know, the elderly were a really hardly hit population during COVID. We saw the huge amounts of deaths that happened, the disproportionate amounts. So I do think that is a very important part of it. But I think what, and the whole, pharmacist administering really makes a lot of sense because I think with studies, 90% of the US population actually live 5 minutes around a pharmacy. So that kind of solves a lot of the accessibility issues. However, what we need to look at that this has actually added to the workload of pharmacists. Even pre-pandemic, surveys and interviews with pharmacists showed that there was a lot of burnout among pharmacists, and this really leading to compromising patient quality of care, whether it was through medication errors, whether it was through less time for counseling, longer wait for services. So this has been an issue. This has added on COVID, of course. We have touched upon how it has really greatly affected all of us, not to talk about our frontline workers. The funding that was added through this federal program was really supposed to help train and recruit new staff so that we could roll out these vaccines. And I do believe that employers may have pushed to do this, but the reality on the ground is that the pharmacists are still overwhelmed. With the pressure of delivering the vaccines, with the pressure of keeping up with the administrative details. It's not just administering, we have the scheduling system, we've been a lot of monitoring new deliveries, proper storage, minimizing wastage. I'm sure a lot of you have come across articles where vaccine doses got wasted. There has been lawsuits against health workers based on not being able to give it out or not properly storing it. And we do know that as of now, the vaccines we have, they do have rigorous storage procedures. How are we following those? Are we training adequately our staff to do that? What really bothers me, health workers are always there and have always filled in the gap of what is necessary, but are they really compensated for this extra work they're doing? It's a shame that we kind of just reserve applause for health workers, but then the profits go to the employers. And this, I think, is one of the pressing things, is the workload and what's the remuneration for health workers that are providing this service.
Yeah, thank you so much, Susmita. Saurabh, I'd love to go back to your point regarding vaccine hesitancy for a second. As you mentioned, vaccine hesitancy largely stems from misinformation, and this is such a key part of getting the world vaccinated. So Susmita, I'd love to hear your thoughts on how we can bridge this knowledge gap and improve transparency of communication between both pharmaceutical companies, governments, and the patients that they're treating?
Yeah, I think what really stood, and I think Shorab already mentioned that, misinformation, disinformation, like bridging the gap. I think that's the thing. How do we take care of patient education and actually not have misinformation? And one of the things that I've always said, how do we, provide this clear channels of communication? And I do think it should be even directly from health workers, and it's working together. Both health workers and patient advocates really working together to know this and forming this. And this should not be when the pandemic happens and after that, like we've done. Like right now, we should be putting those channels of communication through the place. And what you really touched upon, that sometimes it's because it could be information that's not really accessible for the general public. So a lot of the studies that are happening, we keep seeing one line on a newspaper and we're like, oh, what does this mean? mRNA vaccine, mRNA, this is the first time, is it going to really mutate us? And I think the fear really rises for us not understanding that. So that is really important. And I think it's building channels of communications from health workers directly to patients on, what is actually going on.
Just to add a bit to that quickly is to go even beyond the knowledge that we do have and to take other crises that we're dealing with into consideration as we worry about this crisis. Is the climate change crisis currently on its way, only going to get worse in the future? Many of the root causes of climate change also increase the risk of pandemics, future pandemics. And for example, the link between deforestation leading to habitat loss, leading to animal migration, and therefore link an increase in infectious diseases coming from animals. So I think I would just like to highlight that another way we need to deal with this is also to center climate change work in global health policy and vice versa. So we are working with both because it's a big issue for both crises.
Thank you. And then going off of the gaps in knowledge, right? So there are still many things that we don't know about the virus and about the vaccine. One of those things being their effects on pregnant people. We know that there have already been as many as 300,000 people or healthcare workers who have gotten the vaccine who are pregnant, but for those who are still hesitant to get the vaccine because we don't know as much, right? We still have these gaps. Could you speak a bit on what you would say to them?
That's very important. And that, I think Sharp kind of touched upon, it's the fear is not always unjustified. And fear is a good response in people. I do think fear really teaches us to be curious and to understand. I think using fear the right way. So we should not really put aside when people are hesitant. And in this case, it's true that this was really developed in a very short amount of time, but that's because we needed it. It responded to the urgency of the situation and what we have to understand with science. And any medication that's available, there's always a risk-benefit ratio to it. There's always risks to everything, or what we say, the dose makes the poison in some sense. But, that's certainly what we need to keep in the back of the mind. I think when it comes to pregnant individuals, the first thing which has happened in clinical trials, they're usually excluded from them for various reasons. One, because we don't know the effects, and this is, we are putting the fetus at risk that maybe we don't want to get into till when usually they're done in healthy candidates. So that is where I think the fear of this stems from. Like, how does it affect us? What does it do? Or even people who are planning to get, pregnant. I think that was a lot of the case. How do we do it? But the three things that stood out and what it is that, first of all, if a pregnant individual did get COVID, actually it would be worse. And this is why really, vaccinating against it makes sense. Right now, if we're already like 3 months into vaccinating in many places, and there has been a lot of, reports, like the real CDC set up where they were reporting on a lot of things for people who are pregnant. And what we've come to find out that it doesn't really vary much in people who are pregnant from the population that are not. So it does look till now that's safe. And of course, this is developing, and this is why we have post-market surveillance of any drug that's put out there. And this will continue for the next 5 years or so as we collect data. It has also been shown that, vaccination during pregnancy might protect the baby. There is research that shows there are antibodies in the cord blood and breast milk that's suggesting some passive immunity. So I think those are the things to keep in mind. But of course, every person should have these conversations with themselves and their physicians before taking a stand on it.
All right, great, thank you.
I'd like to add here a bit. Okay, so as Susmita said about the pregnant women and the lack of vaccines for pregnant women, as we can see that they are not safe, and they can be, means that is a public perception that they are not safe, and there is a delay in rolling out vaccines for pregnant women. So I'd like to highlight why is that. In my opinion, it is because there is lack of infrastructure, lack of transparency, and lack of workforce and enough number of people or institutions available and dedicatedly working on, infectious diseases or pandemics. We were never prepared for it. We should accept that. And as Sukh said, that environment is changing, and climate change is a real problem now, and the pandemics will keep on coming. So as they keep on coming, we need to get better prepared with the infrastructure, with the institutions, with the workforce, with the money, everything that we have. We have to be prepared for that. We can't say when the next pandemic comes that we don't have vaccines for pregnant women. We have to have that. We have to be available with that. For that, we need institutions, we need workforce. And what is the harm in creating a new and a special workforce only for the problems like these, like pandemics, like vaccinations, and the specific institution? There is only one that we have currently, that is CEPI. And except that, we have nothing else. So what is the harm in creating a new workforce, a new institution, a new infrastructure, all that can deal with the vaccination, immunization, and pandemics, and everything that is related to this? We need to be better prepared. And why can't we? Because we have Peace Corps, we have troops being donated to fight people, to kill people. Why can't we have a workforce to save people? Why can't we figure out the regulations around that? So that is, in my opinion, I think that we should work in that direction. We should save people rather than killing people.
Actually, on that, I was going to suggest, Sharp, I think, there is this talk about drafting a pandemic treaty. This could be one of the things that why can't we have a global vaccination workforce as part of this pandemic treaty? And, as we see that all rights are interrelated. We have been talking for a long time how right to health will affect other rights. And this is the first time we've actually seen that once we did have, a failure in, protecting right to health, it actually had economic implications. This has been on this scale, so it's very visible, but this is something that's always been there. All rights are interrelated. You cannot have one without protecting the other. But this would be a very good proposal for that.
Exactly. I know it's a little bit controversial, but yeah.
I think it comes down, the main thing it comes down is really planning for it. It comes down to the budget and enforcement, right? But it's certainly something worth, like, why can we have it for peace? And I think health is really the same thing. Like, we cannot have peace. Like, we can see it like climate change, peace. These are all related to health and security.
Exactly.
Well, I do 100% agree that preparation is needed, right? And I think that a health or a vaccination workforce could be a very, very cool idea. Sometimes preparation can be taken too far, right? So going back to the rights of health workers, there's also been some talk of making vaccination mandatory for health workers. So I'd love to hear your thoughts on, can we do this? Should we do this?
I think we get back to, the same questions about, can we enforce? I think we mentioned civil liberties. Can we enforce it? What is not? And that's where public health is really not about not about an individual. It's a collective decision. And vaccines are almost, that is the whole idea of vaccines. Unless everybody is vaccinated, you don't get the effect. Yes, there are some free riders in the system, but you do not. But of course, what we have to also understand is what is the fear of these people? Why don't people, like, won't you want to be saved if this was given to you and you had the option? Won't you take it? Well, of course, we have to understand why people are not, and what we touched on, the vaccine hesitancy. We have to remember sometimes it's historical things that we kind of think about. During the Spanish flu, health workers were one of the first groups that were vaccinated. After that, we did see a lot of deaths in health workers. So I can understand where a lot of people feel that. Then we talked about pregnant health workers. It's an intersecting group. It's not that health workers don't get pregnant. Then you have those concerns. You have concerns in younger health workers. Will this affect my fertility as I grow up? How is it going to be? So I think it's addressing all of that, and it goes back to doing that. I know private institutions may have policies like some hospitals do, that if you do not get the required vaccination, you cannot work. As we address these and really breach the gap in vaccine hesitancy, I think what we need to also work on is really working with people with concerns. Can we actually transition some of these people who are hesitant maybe into roles that do not have direct patient contact? Like during this epidemic, we've had people come out of retirement of work. We know there's a shortage of health workers. We know there's a shortage of care workers. How can we also work all together to kind of address these concerns and do it? Right now, I think in Houston, there has been like a rally against it because people, some health workers have walked out because of this. I think it's all about having this dialogue and talking about it, addressing fears, but then at the same end, our goal should be that we are all protected. This should be the goal of it.
I think that is all of the questions that we have for today. So if anyone would like to have a few final thoughts, I know we've touched on a lot of specifics so far, so if I could broaden the conversation for a second, at the 47th World Health Assembly last week, the WHO Director General said, one day the COVID-19 pandemic will be behind us, but the psychological scars will remain for those who have lost loved ones, and we will still face the same vulnerabilities that allowed a small outbreak to become a global pandemic. And at the end of the day, as we've all been saying, it doesn't matter how many vaccines or boosters we make, if we don't start shifting from a reactive to a proactive healthcare system, these vulnerabilities will continue to plague us, and we will continue to have pandemic after pandemic. So my final question for you all is, how do we start making that shift?
I think one of my concerns remains, and perhaps just posing it as a question rather than an answer, is despite losing a lot of health workers to this virus and the circumstances created by this virus, and having a very clear indication of what health workers want, we haven't seen many changes. Health systems still are very fragile, and they very much are reactive. Some of them are barely functioning at this point, and I am very concerned that this pandemic was, I thought, so compelling that we would have big changes, and we would have big positive changes towards labor rights and the rights of health workers. But unfortunately, that hasn't happened. And like sometimes we see even things like paid sick leave, health workers who get infected, who deal with patients with COVID-19, get infected, have to take time off, but don't have paid sick leave. And it's such a destabilizing circumstance to be in. So I guess I'm just adding a question that it's rather than answering that, I don't know what could be compelling enough, but of course we continue advocating and working towards these answers.
Saurabh, do you have any final thoughts?
For me, I'd like to say that the money in the system in the whole healthcare system is the amount is very meager. We don't have enough amount of money and resources, and we need to invest a lot in preventive medicine rather than curative medicine to make our system work as a proactive rather than reactive. So we need a lot of investment in preventive medicine. Alongside, we need to rope in allied medical fraternities as well. Like in India, for suppose, I'd like to highlight that we have different kind of medical systems, healthcare systems, like we have Ayurvedic, we have naturopathy, we have Unani systems, we have different kind of systems. So in countries where there are such kind of system, like Chinese have Chinese medicine, so we need to rope in, we need to walk together, and we need to work more for preventive medicine rather than working on curative medicine. That I feel would be a way forward to proactive healthcare system.
And finally, Susmita, would you like to finish us off?
Thank you. I just had to mute for a minute. If you can hear this buzzing, that's the lawn being cut. I guess this is the realities of home office during the pandemic. So please excuse that. But I think, both Noel and Saurabh, and I think even Suk to some extent, we touch upon what's really important is getting back to being proactive. We talk, there's this whole alma mater declaration that's been going on, moving to primary health systems, then having more specialists, and really, being a system that anticipates as well has the resources when the time arises. In light of that, what stands out to me that are we actually learning from this experience? Are we using this to collect the data that will inform what should happen if if the next pandemic should come around, or, what it is? So like one of the things is the actual cost of healthcare delivery. Like, do we really know about it? We have had a lot of people during the pandemic who have, come back from retirement. A lot of health workers who have actually volunteered. I know a lot of pharmacists who are giving vaccinations on a voluntary basis. These are not getting recorded into that this is kind of the amount we need to put in. And what happens when we don't do that, the next time around, we haven't accounted for it. And we again put in stopgap solutions without system changes that actually account for this. So I think it's very important we do this. And what Suk mentioned is, health workers working overtime. They do not have sick days or holidays. I think this is completely wrong. If we do not account and make this additional resources available, we do not only impinge on the fundamental rights of health workers, we also do not provide patients with the quality of care that they deserve. I think that's why this is very important. Even the number of deaths and infections who have had in health workers, are we really accounting for them? Are we really keeping track of them so it doesn't happen? Really learning from this experience is the main things. And when it comes to vaccination, it's like, are we developing ahead of time? Are we taking into consideration what climate change will affect the health sector? I think these are the main key points I'd like to round off with that we've touched on. I really want to thank all of you for doing this. I want to thank Noel for moderating the session today and guiding us through the conversation. I hope we have been able to touch on a lot of questions on people's minds, those in the health sector and beyond. And as always, we welcome your suggestions, questions, and comments in our social media pages, or email us directly at podcast@healthlawinstitute.org. If you want to be a guest on the next one, do let us know. We'd love to have you there, hear about it. We welcome all voices. And, do join us for our next podcast session on July 8th.